Hey, it's Dr. Jinnie Cristerna, the psychological surgeon, and this video is going to talk about what psychological surgery is. So, a lot of people have come to me and asked me, will I cut open their brain? The answer is no, although the trickster in the shadow part of me wants to go, no, no, but you're not getting your brain cut open, and I don't do that to people, at least not people that I don't know. Okay, that's fair. But basically what psychological surgery is, it's condensing a significant amount of traditional therapy into a single session or a 3-day session. Sometimes it can be 5 days depending on the patient. But you're going deeper faster. And what I mean by that is you're getting as close to the root cause of the issue that you're coming in to work on in a shorter period of time. So if you think about talk therapy, right, it's mind to mind, it's mental. So you're going to only be able to go as far as your mind can take you, right? Ego work, it's about what does the ego know about itself, right? So the ego is kind of the sum of all of our fears. It's trying to manage or mitigate a lot of the things that we're afraid of happening to us. So every time you do ego work, you're just becoming more aware of what you already know, but you want to know how you do it, right? So there's nothing wrong with that. That's more subconscious kind of work. The work that I do in psychological surgery plays in that subconscious space. So if it's a Yandi session, we're only in the subconscious mind. We're only dealing with things that have happened to us that we remember. So these are actual experiences. When we do Rohan, even if we touch on hypnotherapy a little bit, we're going into the unconscious space. Okay, we're going into those places where we don't want to know, we've repressed stuff or something like that, but the bulk of it is symbolic, right? It's very, very psychoanalytic. It's very Jungian. And so what happens is you get to know and understand a lot of things within a single session. And that's why people fly in. You know, Chicago is, you know, it's kind of a gateway to a lot of places in the world, if not most places. But it's not like nearby, you know, where most folks come from. You know, I do have patients in Chicago, but most of my clients fly in. So when they're doing surgery, they're about business. So psychological surgery takes you to the source of that experience. It addresses the emotional anchor and the faulty thought and the behaviors that came with it. So you're getting the whole thing. So this tree, right, is symbolic of the kind of work that I do. This is surgery. We're not pulling things up and just cutting off branches, right? We're pulling them up by the root. Okay? If you cut off a branch on a tree, that branch will grow back on another part of that tree, if not the same part, right? So if you look at the branches as the symptoms, right, the things that you can see and know, that's one thing. But if you understand that that's not where it starts, if you address one branch, it doesn't mean another branch isn't going to grow. We in psychological surgery, we pull up the root, and anything that's connected to that will come up with it. So that means all of the branches, the trunk, right, and a significant portion of the roots. This is why people see the results a lot more quickly and why people are really raving about psychological surgery, because it saves people time. In the end, it is extremely cost effective, because if you come in, for example, for hypnotherapy, you know, people are like, oh, that's been like 6 months to a year's worth of therapy. And I agree. I've done every procedure that I do on my patients. So I have gone through everything that all of my patients go through when they get on the table. But yeah, it's just more efficient. And in the end, it costs less, and then they get to live their life and be happy. I mean, and who doesn't want that? So I hope that answers your question about psychological surgery, with the first being, no, I will not cut open your brain. With that said, if you have more questions about what psychological surgery is and is not, feel free to visit my website at www.highachiever.net. Or if you're like, look, I visited the website, I'm ready to come in, then just give me a call on my cell phone. No, don't call my cell phone. Give me a call at the office, 312-382-8710, extension 150. Bye.